Dental implants explained by a cosmetic dentist near me here in Whangarei. An excellent cosmetic dentist or a prosthodontist is a specialist in cosmetic dentistry. This covers dental veneers, teeth whitening, and more advanced dental tooth implant surgery, and restorative dentistry, and ideally with a particular interest in periodontal gum disease. I met up with cosmetic dentist Dr. Dennis Shepherd in his dental clinic locally right here in Whangarei, who explained how the bone shrinkage in the extraction site drives the urgency in getting your dental implant surgery, ideally within 3 months of a tooth extraction. Here Dr. Dennis Shepherd explains in detail all about dental implant surgery and ideal time frame for implants being placed after a tooth extraction.
When a patient has lost a tooth, the bone will shrink away because the skeleton actually has a number of parts. I've got a very lovely model. Let's get it out the cupboard here.
Yep.
There we go. This has got the different stages of it. When a person has got their teeth, they've got the teeth and the root sits in the bone. Now the jaw skeleton has actually got a bit that's there because there's a skeleton and a bit that's there to hold the teeth in place. The moment the tooth comes out, the bone starts shrinking away, and it shrinks downwards and in thickness as well, and you end up with a very much thinner jawbone until over time, over the person's life, you can end up back just with a skeletal bone.
Right.
Now, in the first year, patients lose up to 56% of the bone that was around that tooth when the tooth is extracted. Timing for implant placement is quite critical. So if we place an implant, we like to get it in there after the first 3 months to allow a bit of healing. Some practitioners are placing them straight away into the extraction site. Now, I've got a lovely little model that will show you what the implants are like. We place an implant if there is available bone, and we choose an implant depending on the thickness of the bone. So where there's thin bone, we use thin implants. Where there's thick bone, we use thick implants. And I tend to use implants that are called southern implants. It's the brand of them that I use, amongst others. This is a very nice model, and it shows what we tend to do. The implant is divided into 3 steps. The first step is we'd cut the gum and place the titanium screw in the underlying bone, depending on the thickness of the available bone and the height of the available bone. We then allow that to sit for 3 months, and the bone will go directly onto the little titanium screw. We then come back and we can make the teeth, which we either cement over the underlying bit, or in some instances, this is my preferred thing, we tend to screw them onto the underlying teeth. So we have a little chimney, and we actually can get access into the screw hole. Most experienced clinicians will try and use a screw retained implant, because if things break, we can unscrew it and send it off to get repaired. This version over here, which is where it's cemented, looks better. There's no doubt that it doesn't look better. But if something goes wrong, we have to start making the top bit again, and additional costs are incurred over there.
Yes. Okay, so the other one can be serviced.
Yes.
And the other one is a sort of a use once only.
Use once only, and if something goes wrong, you start again, which is a bit disappointing for the patient.
Of course. Okay. But it's always better to have some gnashes.
Absolutely.
Okay.